lot of different resources that were good for grants. It could be anything like with the electric bills or utilities, food, all sorts of different things from outside agencies that could do grants. But it felt like as soon as the pandemic hit and months afterwards, that money wasn't available anymore. So a lot of people that they're kind of like, well, what am I going to do? You know, because in the past, this was always something that would help. And then all of a sudden we're having to tell them, I'm so sorry, there's nothing we can do. And for me, that's the worst, is knowing that we've gone through all the resources we've had, trying to maybe find something like transportation for someone, and we're like pulling our hair out looking, being like, how can we help? And then having to tell that patient, there's nothing we can do, and we're so sorry. To me, that's the absolute worst thing.
You go in and you're in someone's home. You're in a very intimate position, in an intimate setting. And so you're getting to meet everybody that's a part of their world. And when they're presenting with food insecurity, you know, you want to do your best to help, you know, provide some kind of nutritional support. You know, if you can't meet your basic needs, then how can you even think about your physical and emotional needs?
You feel physically is going to affect how you feel emotionally, and how you feel emotionally is going to affect how you feel physically. You know, having a cancer diagnosis is already making you feel very vulnerable and very emotionally, distraught. But being able to have resources, being able to have the support, and helping address the barriers to care, and making sure that their emotional and physical well-being are being addressed.
You know, something like the Patient Relief Fund will be, a huge help to those in need. If you're going to the hospital and you have things that are on your mind, and things that are going to contribute to your healing process, if the hospital can help with that, then that's a beautiful thing.
Being able to say, hey, I know you got here, but here's something for you to go home if you can't get home. Or just being able to say to them, listen, we've exhausted all resources, but hey, we can actually help in this area to provide something for our patients. I think, we're a community hospital, where we have to serve our community, and being able to just give them this is a gift to patients, and I know how grateful they are.